have an absolutely incredible speaker here that I had the pleasure of meeting in Fitchburg Senior Center. Kristen Campbell, and she's an OT with UW Care Direct. You'll go away with just some wonderful information, and you will really enjoy everything she's has to offer us today. And Kristen, we can do questions.
Yeah,
Okay.
absolutely.
We'll have time for
Yeah.
questions as well.
I think this
Okay.
is working.
Thank you. Thank you, Kristen.
Yes.
Thank you.
Okay. Perfect. All right. Can you guys hear me now? Yes. Okay. Perfect. So my name is Kristen. Thank you so much, Barbara, and thank you all for being here today and for inviting me. I'm going to talk a little bit about thriving at home from a therapy perspective. So again, my name is Kristen. I'm a home health occupational therapist. I work with UW Healthcare Direct. I have over 5 years experience working in skilled nursing facilities and now over 6 years working in home health, and I love it. Today, we are going to talk a little bit about occupational and physical therapies, define it. And I will say, even though I don't have a PT here with me today, I did collaborate with one of my coworkers. We work so closely with our PTs. They're, phenomenal team members. And so as we talked about thriving at home, staying at home, remaining safe and active, I certainly didn't want to do a disservice of not providing the information about what PT also offers. So I'll talk about both of the roles for all of that. We'll talk about fall prevention, energy conservation, staying active, edema management, which is that swelling, home modifications, adaptive equipment, durable medical equipment, referral to therapy services, and services offered by home health. Obviously, we'll have time for questions at the end, but if you guys have questions at all during the presentation, absolutely raise your hand, interrupt me, let me know so this can be a nice open conversation. So, what is occupational therapy? OT is the therapeutic use of everyday life occupations with individuals or groups. The goal is to enhance or enable participation in roles and situations in various settings, such as home, school, workplace, and community. Occupational therapy is a science-driven, evidence-based profession that helps people of all ages live life to the fullest by promoting health and addressing illness, injury, or disability. Services provided include habilitation, rehabilitation, and health and wellness promotion. That is a mouthful. So I'll break that down a little bit and talk a little bit more about what home health OT is specifically, because it means different things depending on the setting. And this is my coworker, Jackie. She's amazing. She's another OT. She's just been out in the field today. If you want to say anything about yourself.
Hello, everybody. I'm Jackie. I've been an OT for 20 years, working in home health for 9 of those now. So, and working with Kristen for the last
6 plus.
6. So anyway, I cannot stay. I just came to drop off some equipment, and
You're amazing. Thanks, Jackie. So home health OT, we take a look at activities of daily living. We call those ADLs. That's things like dressing, bathing, toileting, grooming, self-feeding. We also take a look at instrumental activities of daily living. That's things like meal preparation, laundry, housekeeping, and medication management. We look at that edema management, fall prevention, energy conservation training. We look at adaptive equipment training. So that's things like determining if a reacher or a sock aid or a dressing stick, a button hook, might help someone get dressed for themselves or take a shower more easily. Those are some of the things that my dear friend Jackie just dropped off in case anyone wants to look at that. Durable medical equipment training and recommendations. That's things like commode, a shower chair, a tub transfer bench, or a grab bar. Arm strengthening and range of motion training, fine motor coordination training, and cognitive screens, exercises, and compensatory strategies. So there's a large umbrella of what we take a look at. And then PT, I think we're a little bit more familiar with what PT is. Physical therapy is treatment provided by a physical therapist or physical therapist assistant that helps people improve their movement and physical function. manage pain and other chronic conditions, and recover from and prevent injury and chronic disease. So we're going to dive right into some fall prevention education. Some of the most common fall risk factors are weak muscles, poor balance, dizziness or lightheadedness, blackouts or loss of consciousness, foot problems, confusion or memory loss, vision and hearing impairments, medication use or disuse, change in behavior, and bladder and bowel conditions. So OT's role in fall prevention looks a little bit more like this. We would take a look at any home safety modifications, such as installing grab bars or adding a ramp, look at adaptive equipment recommendations and training on proper use. So if someone is bending over, they're falling while they're getting dressed, would they use, a long-handled reacher to be able to get dressed so that we're preventing those falls? Functional mobility in their daily activities, cognitive and visual considerations. So things like using schedules, reminders, and labels for taking medication to avoid a medication error, and determining optimal color contrast or lighting changes just to prevent those falls as well as energy conservation and fatigue management. And then PT will take a look at improving the strength and muscle function for an individual, enhancing balance and coordination, gait training, dual task training, which is the physical and cognitive tasks. So sometimes it's as simple as carrying on a conversation while you're walking and making sure that you're able to maintain your balance, because that is one extra component that can lead to falls. Home safety and fall risk assessment, taking a look at footwear and any orthotic devices like an ankle and foot orthosis, and assistive device training, administering a walker or a cane, if that's beneficial in order to prevent falls. So as far as general recommendations, we recommend that we increase lights in every room and in the hallway, keep floors free of clutter, add grab bars in the bathroom, add sturdy handrails on both sides of the stairs, add non-slip mats in the tub or the shower, store items within easy reach, add night lights in every room, and immediately clean spilled liquids, remove hazards from the floor and stairs, such as throw rugs, moving electrical cords so they're not in the way, moving sofas, chairs, and tables to allow enough space for walking, and never leaving anything on the stairs. And then general recommendations for moving and doing tasks with care. Holding onto grab bars and handrails. Don't use chairs with wheels. Don't climb on the chairs or the wobbly ladders. Turn on lights when you're going into a dark room. Make sure all halls, stairways, and entrances are well lit. Installing a nightlight in your bathroom, bedroom, and hallway. Turn lights on if you get up in the middle of the night. Don't rush, slow down, and pick up your feet. Proper foot positioning and footwear. Again, making sure you're picking up your feet when you're walking every day and avoid shuffling. Inspecting your feet every day to check for redness, cuts, sores, blisters, swelling, or loss of sensation. And then taking a look if you have proper footwear. Do you have a good grip? Closed-toed shoes? Are they lightweight? Do they offer good support? And do you have a low heel? Does anyone have any questions? No? Okay. So next we'll talk about energy conservation. This is a huge one for OT. So here are some general recommendations for conserving our energy. Making sure that we're planning ahead, pacing ourselves, prioritizing tasks for the day. So typically I like to say if we have appointments, a doctor appointment, that's where the majority of our energy is going for that day. And trying to figure out how much energy reserve you have for the rest of the day so you can plan accordingly. Sit during tasks, that takes about 25% less energy than if you're doing a task standing. So again, if you know that you have a very busy day, maybe you typically stand while you're washing your face, brushing your teeth. Maybe today you would choose to sit because you know that you've got a long day, a lot of activities, and you may not have that energy at the end of the day, and that can lead to a higher risk for falls. Using assistive devices like those long-handled reachers or grabbers, sock aids, long-handled sponge brushes, and then minimizing any bending and reaching because again, that cuts off your lung capacity, makes it more challenging to breathe, and can again expend a little bit more energy than you need to. Keeping most used items within easy reach, sliding heavy objects rather than lifting them, using rolling carts or walkers to transport items rather than carrying them, such as laundry, resting before you're tired, keeping a daily routine checklist to reduce that mental fatigue, and staying hydrated to decrease risk of fatigue. We'll jump into staying active. Any questions about energy conservation?
I had a question about the OT.
Yeah.
If I wanted somebody to come to my house
Mm-hmm.
to evaluate.
Yes.
Is there a program?
So she asked if she wanted someone to come to her house to evaluate. So if you were able to get a doctor order saying that you needed a home health evaluation for safety, then we would be able to get that. Anytime that there is a referral to home health or outpatient therapies, it's typically a face-to-face visit, an in-person visit with your doctor, and then they can write the order for that. And if you were looking specifically just for an evaluation of the home, just for that home safety assessment, that would probably be specified, just so those recommendations could be made. And we'll talk a little bit more about the referral process, but that's a great question.
So with her question,
Yeah.
does it have to be through UW, or can it be SSM or any doctor?
So, yeah, it would always be through your primary doctor. Through UW Healthcare Direct, we take almost any insurance, but if you were with SSM, they also have their home health company, so they might refer to that home health division first, and that's okay. There are numerous companies around Madison, so we're not the only one, and it does not just have to be a UW doctor. Anyone can refer to us, but typically SSM will refer to their home health division first. So that's a good question. So, staying active. OT's role in exercise and maintaining functional activity. So we assess mobility and function as it relates to daily activities. That really is, the bread and butter of what we do is those day-to-day functions. So we would create a personalized exercise plan. We focus on upper body strength and range of motion training. So we might start exercises, for example, with some of those resistive bands. For home health, we have those. We'll bring those into the home. If someone has hand weights at home, we might use those. And depending on what a person is able to do, sometimes we just do it strictly against gravity. And that's fine too. It's making sure that we can meet someone with where they're at. And we might start hand strengthening and hand coordination exercises, since occupational therapy focuses a lot more on that fine motor coordination and hand strength. So we might have some of that resistive putty that we would bring out to you to work on hand and finger strengthening exercises. Sometimes if someone has arthritis, these are some great exercises. Using household items as well to focus on coordination. So coins, pens, paper, medication bottles, things like that. And physical therapy's role, they're assessing muscle strength, balance, mobility, and endurance. They'll also create a personalized exercise plan. They focus more on legs, hips, core, back, and shoulders. And they might start exercises using resistive bands, weights, just general body weight, or exercise machines, depending on, if you're at home and you have something, or if you're in the clinic. And then they can modify positioning of the exercises from lying to sitting to standing, depending on someone's capabilities, and progress them as they get a little bit stronger. They'll determine pain management techniques or strategies, address cardiovascular conditioning, and address exercise training to maintain bone density and prevent injury. So here's what a recommended weekly exercise routine for seniors might look like. It's recommended to have 3 to 5 days per week of aerobic exercise for 20 to 30 minutes at a time. So things like walking, swimming, cycling, dancing, or chair aerobics. Strength training, improving muscle mass, improving bone density, preventing muscle loss that naturally occurs with age. So some examples of that might be seated leg lifts, squats. Oftentimes they'll say, standing at the sink to hold on to the edge of the sink. and doing some little squats there so that you're safely doing it with some hand support. Wall push-ups, doing it just against the wall and leaning in and out. Resistance band exercises or some light dumbbell exercises. Obviously they have, a ton of weights over here. I don't know if anyone comes to any of the exercise classes here. That's fantastic as well, just for building that muscle, for bone density. Balance and stability exercises, we say 2 to 3 days per week is perfect. So things like standing on one leg, ideally holding on to something so that there's not that risk for falls. Heel to toe walking, so walking in a straight line, placing one foot directly in front of the other. Tai Chi is fantastic for balance. Standing and marching, just marching in place. Or if you have a balance board, that would probably be more with a therapist. And so then we'll take a look at flexibility and stretching. We also say at least 3 to 4 days per week. So seated or standing hamstring stretch, quad stretch, that cat-cow stretch for the back, a chest opener, and neck and shoulder stretches. And cognitive and social activities. So things like puzzles, brain games, memory games, social dancing, groups like this where you can get together with other people, and then just playing games with friends or family. I know that sounds incredibly overwhelming when we put it all together. So this is just an example of how, they're just pairing 2 out of those 5 categories together. So aerobic plus stretching for one day, and strength training and balance exercises for another day. So this is just kind of a nice breakdown if you're thinking about, gosh, how do I do this without it seeming like 2 hours of my day is now being used doing exercises. This breaks it apart so that it doesn't feel quite as overwhelming. And then just general tips when we're starting exercises. Start slow. If you're new to exercising regularly, aim for 10 to 15 minutes at a time and progress from there. Any exercise is better than no exercise. Warming up and cooling down, always include that warm up, the gentle walking or stretching, and a cool down, gentle stretching after exercise to prevent any injury. Make sure that you're staying hydrated. Listen to your body if you're having any pain or discomfort. Either pause, back off a little bit, or stop that particular exercise. And if you have any concerns, you can consult with a doctor. All right, do you guys have any questions about the exercises? No? And so the other, I gave you guys the 2 packets. One of the packets on that front page, it has just a list of a few short exercises. So this by no means is all body comprehensive, and I don't have to go through it, but it's something that if you're looking for something to start with, just to start moving your body a little bit more, it works a variety of muscle groups, and it's fairly comprehensive as far as a little bit of strengthening, a little bit of balance training, not to be too overwhelming with it. So if you guys have any questions about that, let me know as well. So let's talk about edema management. Edema management, that's talking about swelling. Swelling of the limbs, the trunk, sometimes facial swelling. But this is something that OT and some of our PTs focus on quite a bit. So some common diagnoses that present with edema are congestive heart failure, chronic kidney disease, liver failure, chronic venous insufficiency, lymphedema, cellulitis, rheumatoid arthritis, deep vein thrombosis, which is like a blood clot, peripheral artery disease, and surgery of the upper or lower limbs. So, there's a vast number of diagnoses that end up having edema. So what we do for therapy, we provide education on positioning to reduce the swelling, such as elevating the affected limb above the level of the heart so that gravity can pull that out of the limb. Talking about skincare, making sure that we're focusing on hygiene management, moisturizing, and avoiding any pressure that can lead to open sores. Compression education, so using compression garments, stockings, wraps, and then teaching how and when to wear them to reduce swelling. And some individuals, specifically if you have a diagnosis of formal lymphedema, we may be able to assist and fit an individual with a pneumatic compression device that goes over the leg, and it manually massages that fluid out of the limb. We also talk about exercise and movement. That's crucial for edema management. So developing the safe exercise routine to improve circulation and help move that fluid. Range of motion exercises to help maintain that joint flexibility and reduce stiffness. And then manual lymphatic drainage massage. So it's a massage technique similar to that pneumatic pump, but it's something that you and I can do that stimulates our lymphatic system so that we can try and move that fluid out of our body and try and prevent any open sores and risk for more of the chronic stages of edema. And these are just some pictures because I think sometimes we're not quite sure what that edema and lymphedema looks like. So sometimes it looks like it's only swollen on one side of the body, and sometimes it's both sides, depending on what the person has going on. But this just talks through, there are 4 different stages of the lymphedema that even if there's just a little bit of swelling, it can progressively get worse if we're not staying on top of it and trying to treat this as soon as possible. It's not something that we can necessarily get it to go away entirely, but by the time it gets to stage 4, there's a little bit more of that like extensive scarring, that like wart-like growth on the skin, and it's a lot more challenging to be able to manage the edema at that age, at that stage. So if we can try and focus on that at an earlier stage so that it never gets to that point. And then this is the same thing, just showing you a glimpse of what it might look like in the lower extremities. Okay. Does anyone have any questions about edema management, compression garments, anything like that? No? All right. Let's dive right into home modifications. So OT and PT, we also talk about some different modifications in the home after we've done the home safety assessment to decide what might allow someone to maintain, their lifestyle at home as safe as possible. So lever style handles, that's a very easy modification rather than the turning handles. If someone has arthritis, they just have a hard time managing that. Low pile carpeting might be beneficial if someone is using a walker or a cane, or if they have foot drops, so that they're not as likely to trip, to fall, or if someone is using a wheelchair to get around. A no-step entry shower, obviously a little bit easier to manage getting in and out. That's more expensive, but certainly a recommendation that we can make based on how someone is getting around. Video doorbells, sometimes that's a nice one if a person has a harder time getting to the door quickly. If someone rings the doorbell, I think we all feel like we have to get up and rush to the door to be able to answer it in time. And sometimes that's that high fall risk area. So a video doorbell is an easy way. You can have that attached, and it typically connects to an app. So if you speak on there and you say, hey, I'll be there in 2 minutes, then you don't have to rush to be able to get to the door. Ramps. The one on the bottom left there, that is a metal modular ramp. There are permanent ramps, and then there are these metal modular ramps that can be just temporarily placed and then removed if someone doesn't need it after a couple of months, if they're home and they're just using a wheelchair for short term. Widening doorways is another recommendation that we might make just based on our assessment and seeing how someone is getting around. Railings, adding railings on one or both sides of the stairs. The stair lift, that's the top left picture. We'll make that recommendation quite a bit for individuals, even energy conservation wise. They might be able to manage steps, but maybe getting in and out consistently or over time would be too much, and this is just a nice option. And then elevator systems. We don't see those as much. I've only seen that just a handful of times. But if someone is a wheelchair user and either they're getting themselves around on their own, or if they have a caregiver that's getting them around and we can't use a stair lift, Then that top right picture, that's one of the elevator systems that someone might be able to install in their home, allow them to stay at home where they otherwise wouldn't be able to stay, wouldn't be able to stay at home and would have to think about leaving the house just because they can't get in and out with the wheelchair. Any questions about the home modifications?
Are any of those covered by insurance?
He asked if any of these are covered by insurance. So I will say most of them, no, for the more extensive home modifications. I don't know of all of them, but I know that there are financial programs like state by state that you can apply for. It takes a while, for the application and to hear back to see if you receive any like state funding for it. And I don't know a ton about that. I know that those programs exist, but you're right. It usually is a little bit more costly. For the stair lift, if you don't have a wraparound stair, it's just a single flight up. I believe it's somewhere between like $2,000 and $4,000. If it wraps around, to get upstairs that you have to turn a corner, I think it runs more like $13,000 to $18,000, something like that. So, which makes sense that they have to bend that metal all the way around. So it is not necessarily a cheap option, but if it means that, a person chooses to stay at home versus leaving, then it might be the more beneficial option. So that's a good question. You have a question?
Comment on the widening the doorway.
Yeah.
My husband's wheelchair couldn't get right in there, and what I did was I went on Amazon and they have these hinges that give you an extra 3 to 4 inches.
Yeah.
They just fold back the door to the wall, and that really worked, and it wasn't that expensive.
Yeah, I love that idea. I'll just repeat that for the video. She said that as far as widening a doorway, what she was able to find is this hinge that it's like it eliminates that extra width of the doorway. It sets it back. And so if the door itself is the limiting factor for a wheelchair to get through a doorway, then that hinge is a phenomenal idea. I think that's a great idea, a perfect recommendation. Are there any other questions about the home modifications? No? All right. So I have a bunch of slides about adaptive equipment and durable medical equipment. I can go through these a little bit quicker if you guys would like, but what I like about all of this is sometimes, we don't know what we don't know. So there are so many different devices out there, and I think unless we've stumbled across one, just because we've known someone or seen something, we don't know that some of these devices exist. So I want you guys to have this handout as a resource if it ever seems like this is something that could be beneficial to you now or in the future, and at least it has a name attached to it on those slides. So you can inquire about it if you feel like it's something that would be beneficial. So we're gonna go just a little bit quicker with this. Stop me if you guys have any questions. I'm going sort of category to category with the equipment. So we're starting with bathroom equipment. There's a lot. 3-in-1 bariatric commode with drop arms, that's that top left. I like the drop arms if someone is using a slide board or if someone has a hard time picking their body up all the way to scoot over from like a wheelchair over to the commode. You can drop that arm down so they can get on there and off a little easier. There's the standard commode on the right. This thing I think has a laser. There we go. The toilet seat riser with handles. That's this one right here. Usually the toilet seat risers are anywhere from maybe 2 to 5 inches height if you just need a little bit of height, if you need a little bit more. This one bolts to the toilet seat, and then this one is a little easier if you are unable to bolt it to the toilet seat. That one, you just screw it on to clamp a little tighter. It's not quite as secure, but it's still better than nothing. Toilet rails. So I've got 2 different options of toilet rails, and then toilet aids. So if someone has a hard time reaching around to wipe after they've gone to the bathroom, very common after maybe like a spinal injury that you have bending, lifting, twisting restrictions, and all of a sudden you have a hard time wiping, extremely common. So these toilet aids, these right here are more the aids on the right and the left that it clamps onto some toilet paper. It's almost just like an extension of your hand. I have had people use tongs, preferably not metal tongs, but you can use tongs, and you just wrap it around, and then it allows you to get in there a little bit easier. I will say bidets are also a phenomenal tool if you have a hard time wiping or if you expect to have surgery at all. It can do a great job cleaning and drying. Drop down grab bars, that's that top one on the left here. A textured grab bar. I love the texture on the grab bars, particularly in showers. You're already wet. Those bars can get pretty slick, so just that little bit of texture on there can allow you to have a better grip as you're stepping in and out. And then transfer pulls. So I don't know if you guys have seen transfer pulls too often. They typically work more just through pressure. So, you know, you screw it in so that there's pressure on the floor and the ceiling, and it typically does a good job staying in place. You can also bolt it in place, but sometimes there's just no area for a grab bar on a wall, or there's not enough space beside a toilet, or on the tub if you're renting. Sometimes that's a huge barrier, is having something if you're in a rental unit. So sometimes these transfer pulls can be nice. For both of these, it has an adjustment. I don't know if you can kind of see, like right there, that you can actually change the position of the handle that's sticking out from the pole itself. So if he was able to move it here, and then he would be able to switch the position to like over here if he was going over to the toilet. So it can be a nice versatile option. Shower stools and shower chairs with armrests. You know, no matter what, I think if you have something that's height adjustable for a shower seat, that's always preferred. Sliding tub transfer bench and a standard tub transfer bench. The one on the lower left is the sliding tub transfer bench. It's great if you have enough room, if you have a hard time stepping in and out of the tub. Usually that step can be a little bit of a challenge. If someone has balance issues or any, you know, orthotic issues, the sliding one allows you to sit on that seat and then it scoots you over, but it takes up a little bit more space. Otherwise, the standard tub transfer bench is on the lower right, and that one you would sit on the edge so you don't have to step over. You sit down, you swing your legs around, and you scoot into the shower. So again, just decreasing that risk for falls. Showers can be an area that people feel a little bit more anxious if they've ever experienced falls or if their shower gets a little slick. A removable shower head. You guys have, I'm sure, seen those. But then on the right, or excuse me, on the bottom, we have two different styles of suction cup shower head holders. So sometimes the shower head is all the way up top and you have a hard time reaching for that. Reaching for that on its own is a fall risk because you're reaching, you have a hard time balancing. So these are just suction cup down here. I actually have this one right here at my house. It just sticks down, so you can have it a lot lower, especially if you're sitting for showers. Then you can have it, you know, at chest height, and you can place your shower head in there just at chest height, so you don't have to reach all the way up, and it also doesn't have to just dangle freely as water is, you know, streaming through there and it's spraying all over the bathroom. So those are some great, very cost-effective options. Additional bathroom equipment, clamp style grab bars. So if you have a tub and you did not desire or have the option, if you're renting, to install permanent grab bars, these two are nice options again. Truly just through, you know, screwing it, provides pressure on the outside of the tub, so it provides another secure bar there for you. And then suction cup grab bars with indicators. I know everyone's kind of wishy-washy about that. They are not perfect by any means. But if someone has no option to stabilize themselves and steady themselves stepping in and out of a shower and they feel uneasy about that, I would much rather that they at least have the suction cup grab bar just to steady themselves. So, you know, we don't want you putting your full weight on there. But if you need something just for balance, or when you're washing your hair, you close your eyes That's usually where people lose their balance without having that vision, just so you have something to hold on to rather than just, a wet shower wall. And then these that I have here actually show indicators. So I will just Google suction cup grab bars with indicators, or, look on Amazon for it. And so the grab bar itself, I don't know if you can see it very well, but on the side there, it has either a red or a green little mark on it. So if it's losing suction, it'll turn red. So at least you have a visual that it's starting to lose suction. You should remove it, stick it back on there. And when you see green, it's showing that there's a strong suction again. Additional bathroom equipment, long-handled sponge brushes, non-slip mats, or the top far right picture, has some of the strips that you can buy. They're just adhesive strips. It usually sells in a pack of 24. So if you're not a fan of the mat or, whatever texture you have on your floor, the mat doesn't stay well, those are a really nice option as well. And then non-slip shower shoes or sandals. I know some of the hospitals have been handing those out as well, non-slip shower shoes. And some people really like that, so they know that the entire process getting in and out, that they have that security, they have that friction on their foot. Some grooming equipment, long-handled hairbrush and comb. Sometimes it's just arthritis or restrictions after having open heart surgery. You can't lift your arm up high enough to be able to brush your hair. So that's a nice cost-effective option. A hair dryer stand. Again, if you have arthritis or any of those restrictions, then being able to lift that up overhead might be a challenge. Even energy conservation, depending on how long it takes for you to dry your hair. I've got thick hair. I could have used that, for how many years, because it takes forever. So it's a nice option. And then long-handled razor, that bottom right picture. Additional grooming equipment, we have an elongated sink faucet. So if someone is a wheelchair user, or if you sit in front of the sink while you're doing any of your grooming, those top two pictures are showing some, again, cost-effective ways to just get that water to come out to you a little bit easier. Or kids, grandkids, anything like that, if they can't reach the faucet, it's a nice option. Getting toothpaste out, something so simple can be a challenge sometimes if we have arthritis. So these are toothpaste dispensers down here, and then a built-up toothbrush. If it's painful for the hands, especially in the morning, if you have arthritis, holding on to a toothbrush that's so fine, it just provides a thicker handle for you. Some bedroom equipment, we have a bed rail, and maybe you guys are pretty used to seeing this one. This bar here slides under the mattress, and then you have, this bar that's maybe about a foot wide to hold on to so that you can use it to guide you in and out of bed. A bedside commode we already talked about. A bed ladder, that's that bottom picture there. If you're someone who has a hard time sitting up, you're laying flat, you just can't get those abs engaged to get yourself all the way up, a bed ladder can be a great option that you can actually use those arms to help pull you to a sitting position. And then night lights. Dressing equipment. Again, I'm sure you guys have seen the long-handled reachers and grabbers. There's a variety of kinds and lengths. This is that sock aid that you apply the sock over this tool, and then you can sort of fish it out in front of you and slide your foot through the tool, and it helps to get your sock on. That top picture on the right is a specific compression stocking aid, because compression stockings can be quite a bear to get on. So again, it's a tool that allows you to have a little bit more help getting that stocking on without as much of a fight. The bottom left picture is that dressing stick. So it can be used in a variety of ways. She's using it to get, a shirt or a jacket on over the other shoulder. Sometimes that's difficult to reach. Getting socks off is another great way to use a dressing stick. And then this one on the right is a button hook. So if someone has use primarily of just one hand, or just because of arthritis or because buttons have gotten so dang small these days, a button hook can be very beneficial to get dressed. Long-handled shoehorn. You guys have probably seen that. Again, they have a variety of styles. The top right two pictures, those are the shoehorn funnels. So that red piece just sits on the back of the shoe. And rather than have the shoehorn itself, it just makes sure that that back doesn't cave in as you're sliding your foot through. Elastic shoelaces are another option. We've got those on the bottom left. And then the Skechers slip-ins or Kizik's, those are a couple of the brands that are a little bit more common as far as just slip-in shoes. For mobility equipment, we have a variety of walkers. PT would typically be the one who would tell you, what would be the most appropriate depending on your balance, your mobility. The top left is just a standard walker. The right is a front-wheeled walker. The bottom left is that four-wheeled walker or a rollator. And then the bottom right is a knee scooter. So if someone has had anything going on with their foot in particular that they can't put weight on it, that's when a knee scooter might be beneficial. Additional mobility equipment, we've got the Hemi walker. So that has a pretty large base. I've mostly seen that probably with individuals after a stroke if they have limited use of one of their arms, that it still provides a fair amount of support similar to a walker, but if they're not able to use both hands to actually support themselves. And then we have a single point cane. This is a small based quad cane and a large based quad cane. And again, a PT would be the perfect person to do an assessment to see which style would be most appropriate depending on your balance and gait pattern, and do some training on how to use it. Mobility equipment that we might recommend would be either a manual wheelchair, which is that top left, a transport wheelchair, which, I like. It's typically about 20 to 25 pounds less than the manual wheelchair if you're having someone assist with getting that in and out of the vehicle for appointments. I believe the manual wheelchair is typically 45 to 60 pounds, and transport wheelchairs on the light end I think is about 12 to 25 pounds. So it can be a lot easier for the family as well. And then we can also assist in determining if someone is appropriate for a motorized scooter or an electric wheelchair, and if, determining if someone is appropriate to have a doctor order for that, to have their insurance pay for part of, whatever mobility device they might need. And then transfer equipment. So we also make recommendations if someone is appropriate for a Hoyer lift, which is that top left picture, a lift chair. The bottom left picture, I'm a big fan of the furniture risers. I don't know if a lot of you have seen them, but sometimes the furniture itself, the couch that we've had for 20, 30 years just seems a little too low, but you're not really looking to invest in a new couch. But these furniture risers that sit under the legs of the couch, I believe they have platforms anywhere from 2 inches to 5 inches in height. So rather than invest in something else or throw a bunch of pillows or cushions on top of your favorite spot on the couch, this is a nice, easy way just to bring that up a little bit. And then as far as some other transfer aids, we might recommend a sit-to-stand lift, which is that middle picture, or a Sarah Study, that far right picture. And then medication management tools. Standard pill boxes we'll recommend. We also might recommend that someone has an automatic pill dispenser that alarms and distributes meds at a specific time. If someone is having difficulty taking medications, remembering to, they usually have alarms as well, to make sure that someone is remembering to take them. We might recommend timers, pill splitters, pill crushers, assist with putting together a medication list or a chart that works well for that individual, color coding bottles, if that helps to sort out AM versus PM or noon meds, and then some people like to use the medication apps, and we can help set those up too. Some tools for arthritis of the hands. An electric can opener is a great option. Built-up handled eating and writing utensils. So sometimes it comes that way. Sometimes we can just slide a foam tube on it. So it's a little bit thicker, more comfortable for an arthritic hand. Large TV remotes, grip pads for opening bottles or jars. That top right picture is the key handle for turning keys. Sometimes the keys are so small, it's challenging to do that motion. That helps to be able to manipulate that a little easier. Grip Solutions or Dyson, that's that bottom left picture. It's, a sticky material that decreases that risk of of something slipping, but it's not actually adhesive. So it's a nice option to put on a walker tray or a walker seat so that you're not having spills if you're transporting food items. And then splints for the hand. That might be something that we would recommend if someone has arthritis of the hand, they're having a hard time doing their day-to-day activities, and that splint can just provide that stability of the joint and allow them to do those day-to-day activities a little bit easier. Does anyone have questions? I know it's been a while since I've asked. Is everyone doing okay? Okay. Tools for low vision, looking at different magnifying glasses. We can assist with magnification level, size, where it should go, contrast colors, recommending audiobooks, getting someone set up with audiobooks, looking at different large print, what might be helpful for the person. Bump dots, that's that top left picture. I've used those quite a bit with individuals using buttons like on the microwave or the stove, so if they have a hard time figuring out the difference in numbers or which stove correlates to, which button on the burner. Sometimes those bump dots can help with that. Talking clocks and talking scales. So I'm just going to kind of breeze through. This just gives some information about different medical alert devices. I think we're all familiar with some of them, but it just gives some different options depending on what you might need or someone you know might need. I think most of us know about the Life Alert that uses the landline or cellular connection. Usually you wear it either on your wrist or around your neck. And this goes through pros and cons. So it's simple, it's reliable, it only works inside or near the home. There's more mobile medical alert systems with GPS and cellular service. For those of you that are still pretty active in the community, which probably most of you are, if you were ever looking for something, this style would probably be a better option. And so it gives examples, Medical Guardian, Mobile Help, Lively Mobile Plus. The con, it says it needs charging, typically higher monthly fee for something like that. There are some that have automatic fall detection. So if the person that needs this has more issues with losing consciousness, this might be, a good option for that person because they don't need to press a button. It can just tell when there's that change in plane. So I think one of these talks about some of those. Sorry, I thought that one had a specific, told us exactly which one. I think it's on another one of these slides here. So then there's monitored and non-monitored. Most of them are monitored, so 24/7 emergency response center. It'll contact EMS or family. And then there's also non-monitored devices. So the alerts go to a family member or to a caregiver. So like smartwatches, that would be an example of a non-monitored device. So wearable smart medical devices, like smartwatches, there we go, can take a look at fall detection as well. So Apple Watch is one of them that has fall detection, which is great. Lively smartwatch and Medical Guardian smartwatch all have that the fall detection feature. And again, allows you to be much more mobile in the community, and it can still sense when that might be occurring. And then there's also the voice-activated emergency systems. So an Alexa or a Google Home has that capability. I think last time that we had presented, Barbara, when you were there too, I think someone had mentioned that Alexa, I think you currently have to pay an extra small fee if you want that connected directly to like 911. It used to be free. But I'm fairly certain that if you allow your Alexa device to have access to your phone contacts, that you could still say, call my daughter, call, whoever your contact person is.
You can.
Yeah, and Barbara's saying you can. So it's still a nice option if that's something that you have at your home, just to be aware of that, if something were to occur, you can still use that as an extra safety feature. So, do you guys have any questions so far? Yes.
It's not a question, just
Yeah.
a comment, in case there's anybody here that doesn't know, which I can't believe. But the senior center has a lot of those adaptive devices here
Yes.
in the loan closet, that if you are in a situation where you need something or want to try something out before you go and purchase it, you can borrow it from here for nothing.
Absolutely. And just for the video, I'll repeat that. So she's just saying that a lot of that adaptive equipment and durable medical equipment that we had talked about, so much of it the senior center has in the loan closet. I absolutely agree. I would 100% reach out to them to see what they have first. I know that I reach out to them, almost on a weekly basis, or to the different senior centers about what they might have available for an individual that might need it. They're a phenomenal resource. So yeah, that's a great point. So I just wanted to touch on therapy referrals, home health versus outpatient, because sometimes I feel like that line is just a little fuzzy. So for home health, which is what I do, first and foremost, someone has to be considered homebound, either temporarily or long-term. The only exception that I'm aware of is sometimes if someone has Medicaid as their primary payer source, and usually that's more just for like young kiddos that is the reason. But so with that said, homebound means that at the time someone is having difficulty leaving their home, or that it's unsafe for them to leave home by themselves, or with whoever their primary caregiver is. So recovering from a major surgery or injury, things like hip replacements, knee replacements, spinal surgeries, at least temporarily, someone is typically considered homebound. Those are pretty major surgeries. Severe mobility or balance issues, if someone has had multiple falls, if someone has Parkinson's, perhaps, that their mobility has gotten much worse. Those are, the reasons someone might need home health. Chronic illnesses or conditions that make it difficult to travel. If someone has cancer, if they have COPD, they're oxygen dependent, all of those things that make it much more taxing on a person to safely get to and from outpatient, then absolutely you can justify getting home health therapies. When it's appropriate for someone to have outpatient is, first, if they're able to travel to and from a therapy facility, if someone requires more intensive therapy, if they benefit from group therapy or a more social setting. Sometimes those therapy gyms can be much more motivating if you're someone who likes to work with other individuals, see how someone else is progressing as well. If recovery is progressing and you are able to do more on your own. So again, if someone has a total hip or a total knee replacement, we might see them for maybe 2 weeks, maybe 4 weeks, and then at that time, they're safe, they feel confident, they can handle that level of outpatient care, and then we assist with that transition. Or if someone requires specialized therapy services, so hand therapy, is such a specialty, you would probably need to get to outpatient for that. Neurological therapy, if someone needs more devices, constant electrical stimulation or ultrasound, or some of those machines that we can't necessarily bring into the home. Or if someone needs, a therapist, but then also a rehab tech just for safety, so additional hands on the person so that they can rehab them safer. Those are the appropriate times to be referred to outpatient therapy. So I don't have to talk too much about this screen, what home health OT and PT can offer. We just talked about that this whole time. But I do want to focus as well on our amazing speech therapists and nurses. I certainly don't want to neglect, the importance of what they can do and the impact that they have. So speech therapists, they focus on speech and language disorders, taking a look at swallowing disorders, which is like dysphagia, So they might provide education on different exercises for swallowing to help build that up. Let's say someone had a stroke, they're having difficulty swallowing, they're choking, so they can work on the exercises, but then they can also work with providing recommendations for the appropriate kinds of food. You know, do they need pureed food? Do they need their food at a particular consistency so that they can safely eat without that risk for aspiration? Cognitive and communication disorders, so things like a stroke, traumatic brain injury, that, you know, maybe word finding, getting the correct word is a little bit more jumbled, and they can help with some of those exercises so that it can streamline a little bit better, make sure someone is maximizing their communication and returning to that. Voice disorders, so, you know, hoarseness, if that vocal quality is diminished, they can work on exercises for that as well. And then social communication. So maybe if an individual has autism or a developmental delay, taking a look at some different ways that that person might be able to still socialize within their community. And then home health nursing. Our nurses will take a look at medication management, go through the medication lists, you know, what their purpose is, side effects, are there any interactions, make sure that everything is, you know, set up the way it needs to be so that you feel confident. Wound care is a big part of what our home health nurses do. They'll communicate with the wound clinic, they can take pictures, they can make recommendations to the doctors and have that, you know, live feedback about what kind of wound care should occur. And then most importantly, you know, they'll do the training with the person themselves or with caregivers so that that person can then take over that wound care at home without having to go to and from the clinic. Chronic disease management, so things like diabetes, COPD, CHF, just talking about what are some of the typical symptoms, how we can track that, and then again, making sure that they're very aware of what that looks like when they're becoming symptomatic and how to prevent that, how to communicate with the doctors. Post-surgical care, that would be things like if someone, you know, had a knee or a hip replacement or spinal surgery, just taking a look at the surgical incision and making sure that there are no complications. They'll take vitals every single visit, make sure that that's trending well, and then any additional patient and family education. And then lastly, my last two slides here, I just wanted to go through examples of diagnoses that are appropriate for therapy. While the diagnosis itself may not be the reason, you know, that someone needs therapy, say someone has a urinary tract infection, that doesn't by itself mean that someone needs therapy. But if it's causing weakness, confusion, high risk for falls, because all of that is so common, those are the reasons why therapy is beneficial to get someone feeling better and back on their feet right away. So here are some of the diagnoses that, you know, I went through my list. What do I see? So generalized weakness, frequent falls, acute exacerbation of congestive heart failure, knee, hip, or shoulder replacement, urinary tract infection, spinal surgery, dementia, COPD exacerbation, arthritis, Parkinson's, pneumonia, cellulitis, lymphedema, stroke, fractures, pain, difficulty walking, contractures of the hand, low vision, bladder incontinence, unsteadiness on feet, pressure ulcer, osteoporosis, chronic kidney disease, amputation, mastectomy. And I mean, the list goes on and on. So I just want everyone to know that, you know, it doesn't mean that just because you have a urinary tract infection or low vision, that because that doesn't feel like something that therapy could be involved in, that we absolutely can. You know, if anything is impacting your mobility and your day-to-day activities, you know, certainly we can get involved and help with that. All right, and that's all that I have. Thank you guys so much for listening. Do you guys have any more questions?
This is an odd question.
Yeah.
If you want to back up.
Yeah.
It had the swallowing disorders.
Yeah.
Well, I have a problem that I get choking
Yeah.
but I'm not choking on food,
Okay.
but I just can't get my breath. What do you do in a case like that?
So, I mean, I think that's a great question to talk to your doctor about and see, you know, if they feel like there's, you are choking a little bit or you're not choking at all.
I'm not choking on food or anything,
Okay.
it's that I just can't get my breath. I go, ah.
Sure. Okay. So, honestly, I would probably talk to your doctor about it to see if they think that it's more from the, like, I don't know, speech and getting the breath like that, that coordination of the muscles, or if there's anything more lung-wise, pulmonology-wise, that they wanted to take a look at. Maybe they would take a closer look. Is your oxygen level okay? Are your lungs fully expanding? Just to see which area of the body is kind of impacting that. I think that's a great question.
I know that whoever's with me, it just scares them to death.
Sure.
They like speaking it,
Yeah,
but they don't know whether to hit me on the back
sure.
or
Or do Heimlich? Yeah.
We don't know what to do,
Okay.
so
I think that would be a great one for you to talk to your doctor about, and
the doctor can ask them.
yeah, and maybe see if whoever is, you know, typically with you, because they, you know, they're aware of what's going on, they can help describe what's happening at the time. If there's, you know, anything that they can see that consistently happens, or if it's just out of the blue. I would chat about that with your doctor and just let them know so that if they need to do any tests or referrals to any different doctors or therapies, that, you know, they can get on that before it becomes a bigger issue. Sorry.
Does Medicare cover OT, PT, and speech therapy?
So they, yes, Medicare does cover all of it. Typically, Medicare will cover if someone is referred to home health therapies. Typically, Medicare will cover all of that without any additional copay or fee. The only caveat with home health is that for most home health, either nursing or PT has to be involved as well to do the start of care visit. I don't know, it was Medicare regulations 1,000 years ago. And so sometimes a nurse will do a start of care visit, even though, let's say you only need OT or only need speech, and they can decide it's just a single visit, and then speech therapy would get involved. So that is no cost. Usually for outpatient, there is a copay or a co-insurance depending on, you know, if you have like Medicare Part B or if you have a supplemental insurance, that kind of depends on what the coverage would be. But typically per outpatient visit, for outpatient therapies, there's usually a copay. So yeah, that would be something that you'd have to figure out with the insurance. So it's usually only, I think, typically about $20 like per visit. So not horrible, but depending again, if you have any supplemental that covers part of that cost too. That's a good question. Are there any other questions?
So you're gonna find most of this stuff on Amazon?
Most of the equipment?
Yeah.
Yep, absolutely. And I would say if you're looking for any of it, you know, you've got some of the base keywords that you might need on that handout, and then it usually will suggest, you know, some different options for you. Absolutely, you know. I recommend Amazon for a lot of the equipment just because there's so much out there. And honestly, it's typically cheaper than going in store, unfortunately. Do you have a question as well?
I did have one in regards to the walkers. How is it determined if a person can use a post walker, one with skis or one with wheels?
So typically the PT would assess what would be best, but sometimes it's more environmental. You know, a lot of the front-wheeled walkers, at least, will have the wheels on the front, and then the skis on those back two posts. That is typically recommended rather than just those. Yeah, there's a walker right here that has skis on the back.
Got skis up the back.
Yep. Oh, you know what? I think I just turned this off. Yeah, so this is typically what you might see from a front-wheeled walker. Thank you, guys. Just because those rubber posts in the back typically just add more friction. That's probably the most common. Sometimes we'll say tennis balls.
They wear out.
Yeah, so she said they wear out. Usually I only recommend tennis balls if someone has like hardwood floor, because some of the hardwood floor, the skis can actually leave permanent indents. So I like to make sure people are aware of that before they're choosing one or the other. But yes, the tennis balls do wear out quicker. So
I was just wondering, because I have full knee replacement coming up in November.
Sure.
I'm gonna need to use a walker for a time.
yeah. And you know, I think that's a great conversation when you have PT either beforehand. I don't know if they're doing a short program before you have the replacement or not. But certainly while you're still at the hospital, and just kind of think about, you know, what works best. If you do have carpeting and if you don't have to worry about hardwood floor, then I think skis are the best because they're also the best outside. You don't have to worry about that friction of, you know, the gravel or anything. But yeah, it's just that hardwood floor sometimes is not the best for those walker skis. So, any other questions? No? All right, thank you guys so much.